Welcome, everybody. Sorry that we missed you today, and I'm hoping that you'll get a chance to look at this recording just to give you a bit of an update on health and wellness coaching and cancer coaching in particular. And I'm just going to share my slides now. So this session that we're going to do today is going to be changing the cancer narrative, the power of cancer coaching. So one of the things that we'll be talking about, particularly in the objectives for the course today, is really to provide you an overview of health and wellness coaching and how it can change the cancer narrative to one of hope and thriving. To discuss key learning concepts emphasized in the first National Board for Health and Wellness Coaching certification course, specializing in cancer populations, and to engage you in dialogue about your future in cancer coaching and address any questions you may have about the course. So, of course, because you were not able to attend today, you won't be able to engage in discussion, but certainly do feel free to email any one of us from Healthville, myself, or Marianne, or Rohit, the director himself, and you can find all those addresses on the Healthville Cancer, the Healthville website, and certainly mine is in this set of slides as well. So just to get us started in thinking about this whole area of changing the cancer narrative, the power of cancer coaching, I think it's important just to remember that, people with cancer have very, very specific needs. Hearing that diagnosis that you have cancer is devastating. You're overwhelmed with this, massive amount of information that's out there. Often there isn't anybody to help you interpret that information, to interpret even things related to your prognosis, what they're telling you about the actual cancer type that you have, what is the cancer treatment that you need to be thinking about, and what are the kind of side effects that you're going to be dealing with. So usually that first diagnosis is overwhelming. People can be, have a lot of cognitive overwhelm related to the cancer diagnosis. And of course, cancer, I hear so often people you know, I just became a cancer patient. I'm now cancer. Cancer is everything. It just surrounds the person in terms of, and sort of, replaces their sense of identity, creates a sense of vulnerability, a loss of control, a sense of uncertainty about their future and their life, and even threatens their whole sense of being. So when we think about cancer, it's a very unique population that we need to be thinking about. How do we apply cancer coaching to this population to address those issues and the emotional distress that is part and parcel of dealing with this diagnosis, in addition to the fact that they're learning a whole new language, trying to understand how to deal with that, how to deal with the family issues, and then, of course, how to deal with this new cancer care system, and navigate all the silos of healthcare that can be in existence for people going through any kind of diagnosis, but particularly cancer diagnosis. So, the challenge with cancer populations is, cancer coaching has really lagged for this population. While it's very prominent for conditions such as diabetes, asthma, congestive heart failure, as a rehabilitation approach, coaching's been pretty prominent in those other chronic diseases. But there's been very little focus on cancer and cancer coaching. In addition to that, there's always this sort of silo of lack of connection within the healthcare system and all of the places that you need to go for the kind of supportive care that you need to get through this experience. So we think a cancer coach is a solution, to really come alongside people, support them through this experience of dealing with a cancer diagnosis, alongside their family members, of course. And so take a few moments to reflect on your why. Why do you want to become a cancer health and wellness coach? Why is this important to you? Where does your passion come from? And what are you willing to invest? This is, a lifelong experience that, in addition to the course, you will need to be thinking about how you will contribute to your ongoing continuing education and lifelong learning to become a masterful coach. And we're going to talk about that a little bit in a few moments. Going to just enlarge my slides. So just to start, with a little bit of the health and wellness coaching definitions. And as you know, our National Board for Health and Wellness Coaching program is particularly geared for helping you to attain all the competencies that are required for a health and wellness coach. But the difference is we do truly tailor this to cancer populations so that you'll know how to apply these tools and these skills that you're learning about to people with cancer. So just to remind you, and these are probably terms you may or may not be used to, and there's so many definitions out there around health and wellness coaching, but I think these two are kind of two that resonate with me, and particularly the top one that reminds us that health and wellness coaching is really a person-centered approach, wherein the person at least partially determines their goals. They use self-discovery or active learning processes together with content education to work toward their goals. And we as coaches really help to facilitate that. And of course, they use skills such as self-monitoring, and we help them with that, and we help them with accountability around goal setting and achieving the kind of goals that are consistent with their health values and their life values that they want to achieve to get through that experience of cancer and change that narrative of the story of the overwhelm and the uncertainty and all that entails in a cancer situation. And of course, all of it is within the context of an interpersonal relationship with a coach. So, there are lots of coaches out there that hang up their shingle, but the advantage of really being a certified coach is the fact that you are going to learn the skill sets that will give you the confidence, the capability to really actually provide effective coaching that hopefully will help people with cancer to actually reconnect with their well-being, resilience, and an ability to thrive. So the coach, of course, is a healthcare professional, or it could certainly be, there are peer supports, but in this situation, we are training healthcare professionals that are trained in behavior change theory, motivational strategies, and communication techniques. And all these, of course, are used to assist patients to develop their intrinsic motivation and obtain skills to create sustainable change for improved health and well-being. The benefits of health and wellness coaching, there are sort of numerous studies in this area. And sort of if you think about it from a healthcare system perspective, the Quality Chasm report many, many years ago raised this whole issue of needing to reach what we call the triple aim of healthcare delivery, that we're improving patient care, we're reducing healthcare costs, especially when it comes to chronic disease, and of course, improving the overall health of populations. There's certainly another aim, a quadruple aim, pictorial representation of that, and that also reflects the patient, the provider, and the provider's experience in terms of what they offer to people, and that they actually have a role to play in their own well-being as part and parcel of that triple or quadruple aim approach. But what we do know is, and many of these evidence-based sources I've actually contributed to in my own research program, is of course reduced symptom severity. And there's, a much stronger evidence base now that not only does cancer coaching reduce fatigue, pain, but also cognitive change, offers hope for sexuality change within sexual issues related to that, functional impairment, improving physical functioning, etc. Of course, reducing emotional distress, good evidence. You can see here that it's a pretty large effect size, what we call a pretty large effect size, showing that emotional distress is definitely improved. And of course, there's lots of other ways that we can do that through helping people to gain not only improved coping skills and some of the things we emphasize within cancer coaching, but also helping them to regain some health behaviors such as physical activity, which also can reduce emotional distress, depression, and even additionally anxiety. The other, of course, in terms of the benefits of health and wellness coaching, is that reduced morbidity and mortality. So there are large Australian population-based studies of coaching within survivor population, cancer survivors that have showed weight loss, changes in body metabolic index, H1C levels for blood sugar, HbA1c, blood pressure, lipids, all of those can be reduced with health coaching, where there's a really good therapeutic working alliance between the coach and the client. And then, of course, we do know that the higher the level of activity, the lower is the mortality related to cancer. And of course, all these behaviors are equally important for cancer prevention. And that also can translate into reduced costs, reduced emergency department visits in Sweden. They've really sort of taken on this whole idea of health coaching and self-management and fostering self-management in health populations. Similarly, the UK has now adopted a whole process for their long-term care populations around health and wellness coaching and are training up frontline providers to actually deliver cancer coaching conversations and really focus on reducing all of the things that are aimed for and improving in the triple aim as shown in this slide. So definitely reduction in hospitalization and department visit rates is common as well. So, as I said earlier, we are teaching in this course that you'll be having those competencies around health and wellness coaching, and that's required of us as an accredited program of the National Board for Health and Wellness Coaching. But what's unique about our course is that we actually do help you to learn how to apply all those health and wellness coaching competencies to a cancer populations. So this is somewhat similar, but I want to drill down a little bit deeper into what is cancer coaching and share some benefits of cancer coaching in another slide shortly. But it is truly person-centered. It's collaborative. It's about shared agenda setting and working with the client as to where they're at, meeting them where they're at, recognizing them as an autonomous being and having autonomy in what their health looks like, what they're trying to pursue in restoration of their health and well-being, and of course, viewing them as an expert in their illness and in their life context. So much of what we do in coaching is to learn about that person and to be able to tailor, even goal setting tailored to the person with cancer, where they're at across the trajectory of cancer or their journey of cancer, and to really guide them in recovering their health, restoring well-being. And of course, one of the really important aspects of this, it does, of course, include navigation, helping people to navigate additional resources they might need if there's emotional distress that's quite significant. And of course, the cancer coach would navigate them to psychotherapeutic or therapeutic interventions that's more focused on counseling or psychodynamic therapy, etc. But we do focus also on health and cancer education. That's really important because so often they're struggling with the amount of information, how to apply that information to their situation. And so we do a lot of interpretation, but we also use a particular approach to, I'm not the expert telling you what you need to do, but actually using a type of coaching that is focused on education, but it's always within the coaching context. So we're always keeping our coach hat on and providing information, which is just even as simple as asking a person permission around sharing information and education. So often as experts, we just decide what people need and we try to teach them everything, and then wonder why they're overwhelmed and calling us in crisis when they go home from our ambulatory cancer center. So that's a really important component, and we do that within that coaching context. So it's a very different way of delivering both cancer and health education that you'll be learning about in this course. And of course, it's focused on optimizing health, of course, and well-being and the client's achievement of health-related goals. In addition, of course, it's focused on motivating self-determined behavior change through a supportive collaborative partnership And you'll learn about motivational interviewing, and you'll learn about good motivational and person-centered communication skills to create that collaborative partnership between the client and the coach, which is fundamental. That therapeutic working alliance that I'm really talking to and alluding to here is absolutely critical to the benefits we see from health and wellness coaching, and then, of course, particularly with cancer population. The focus, of course, of cancer coaching is similar to what we see in health and wellness coaching, that we build on the client's self-efficacy. What's a bit uniquely different about cancer and maybe some other chronic diseases as well is that we need to understand the person's capacity. So much of during acute cancer, people with cancer can be really quite cognitively overwhelmed. So we need to understand their capacity to self-manage. We need to understand their capacity for adopting certain behaviors, and we need to be able to tailor those to where they're at in their disease and any specific precautions perhaps for around physical activity, etc. And of course, they're trying to do this in the context of this emotional distress and the uncertainty and all the emotional aspects that can be part and parcel of the cancer experience. So it's really being cognizant of that and being able to tailor our coaching approach accordingly. And then so we do enable problem-specific self-management. What that really means is, with cancer fatigue, we know there are very, very specific sets of strategies, self-management strategies that will improve cancer fatigue, not only just physical activity, but things like energy conservation, yoga or mindfulness, for instance. So very specific self-management strategies that they can apply. And then, of course, alongside other health behaviors to manage both cancer and treatment impact, but hopefully to restore and optimize their health as well, both during the acute phases and during that post-cancer treatment, and additionally for those with advanced disease. So cancer coaching can be applied across the whole of the cancer continuum, and very often some of the specific needs related to that is supporting coaching for return to work, supporting coaching for living with cancer as a chronic illness. In addition to that, living and dealing with all the aspects of living with the acute cancer treatment effects as well, and how to maintain some level of health behaviors during that acute treatment onslaught and all the side effects that entails as well. Most important is, of course, I'm just closing off those reminders in case you're seeing those, is using a strength-based approach, really to empower and enable the client to regain control of their health, wellness, and to really emphasize some really important aspects of psychological elements of wellness, thriving, flourishing, and you'll be learning about tools and the theoretical underpinnings of those approaches. And we will be teaching you how to apply them in working with cancer populations to hopefully achieve those outcomes. So the benefits of cancer coaching that we think about, and of course, as you saw, there's some very strong evidence, but cancer coaching, as I said earlier, has really lagged the uptake within cancer support services. And so it's very prominent, as you know, that coaching is prominent in cardiac disease as part of rehabilitation following a myocardial infarction. It's very prominent in asthma. It's very prominent in diabetes. You don't go through diabetes without often receiving a diabetes coach is going to help you through that. But for some reason with cancer, we just kind of make this assumption that people will figure it out. They're adults, they can figure out, they'll find the resources, they'll get the support they need, but that is not the case. And that's certainly not my experience in people who come to me for cancer coaching. So it really is important that we start to think about how do we make sure that we spread and scale and really have this wider spread reach for cancer coaching in supportive care and healthcare sort of globally and around the world. So the benefits of cancer coaching, of course, is that it is a powerful tool to help patients and caregivers and to identify and integrate health promoting behaviors, particularly during and after treatment, to optimize their health and well-being. It focuses, of course, on coping skills, resilience, some of those things that I'll speak to in a moment. And it can be that you're through health education and delivering that within the coaching context, that you're a guide for sorting through often overwhelming health information and creating a realistic plan that enables a person with cancer to make positive, sustainable health supporting changes. As I said earlier, it's strength-based and it draws heavily from the field of positive psychology, focusing on the client's strengths, their interests, their intrinsic motivation, their health values, their life values, and really what matters most to them at this point in time. Equally powerful and important, of course, is that cancer coaches focus on helping people to manage the emotional stress, the stress that is part and parcel of a cancer experience, but part and parcel of just life as well. Helping to reframe emotions, being able to promote coping, and to be able, through that theoretical underpinnings and specific tools that we'll be teaching you in the course from positive psychology, you'll learn how to support people to thrive and flourish, and reconnect with their wellness and their whole person idea of what health looks like to them and what wellness looks like for them and well-being. Of course, it focuses on the whole person. We know, that's the huge difference here. So much of cancer care is focused on biology, treatment, tumor management, treatment effects, managing the the tumor, managing the cancer as a physiological entity. A lot less is focused on the whole person aspect of getting through a cancer experience, and hopefully being able to restore to that person that sense of living well, wellness, well-being, and as I said, fostering, thriving, and flourishing. So we do focus on the emotional, physical, psychological, mental health, spiritual, financial, and intellectual area. And of course, those are the definitions of wellness, or the domains of wellness, but no area is off limits to really help that person to restore living well with cancer and their well-being. It's so much more though, that sounds so instrumental, and I hope you're getting that idea of what it is that we're really talking about. But really, it's so much more in the sense that we have to think about the art of coaching and masterful coaching, and how do we sort of embark on this first course and then perhaps lifelong learning to become masterful coaches. And you have to think about this investment as your first training, but in fact, it's so much more about being able to think about how do I keep growing and how do I keep practicing my skills, applying my skills, practice, so that I actually can become a masterful coach that makes that true difference in what it's like to experience and go through a cancer diagnosis. So, of course, some of the techniques or skills that coaches use is engaging the client or the survivor cancer person, individual with cancer, in conversations that inspire motivation, using powerful questions, using silence as a powerful technique, authentic listening, and all of the skills of both person-centered communication and, of course, motivational interviewing communication skills as well. And then really focusing on value goal attainment for this person. It means that we also emphasize that we get to know people in terms of, what is their work, what is their play, what is their relationships in their life, what is their leisure activities, their life purpose, and of course, what are the health challenges that they're facing as well. So we emphasize their interests, their strengths, their passion. What are their values? Taking away the power of cancer, hopefully, as overwhelming and subsuming their identity. So many times that when people come to me for cancer coaching, they'll talk about, I want to get back to being me. I want to remember who I was. I want to actually not just focus on, I'm now a cancer patient. And they often will use those words, I'm a cancer patient. But no, I need to be able to reconstitute my identity, reconstitute the meaning and purpose in my life, and regain some connection and resilience with others, and all of those potential things, such as relationship that is disrupted by a cancer diagnosis. It means that, when we talk about the best self, you can kind of see on this right side of the slide that we, as coaches, as Margaret Moore says, we support the client as they carve away life's clutter to reveal their best selves. So we help them to find their best selves and where they want to get to, because so often they can feel like, I'm cancer now. I'm a cancer patient, versus bringing back who are their best selves. What do they want to achieve? And so often they say, I really want to live life more purposefully. That's what, and they do talk about sometimes cancer being a gift to help them to revisit their values, re-understand what their values are, both their health values, their life values, to be able to reach this vision of who they see as their best selves. And that's a technique you will use and learn about, and will teach you in this course. I think Michelangelo really sort of, summarizes what we think about when we think about carving away that clutter to reveal their best selves. When he was asked how he went about the sculpting process, he says, "I saw the angel in the marble and I carved until I set him free." In many ways, that is what a masterful cancer coach does. So we do teach you that positive psychology approach to coaching, which is harnessing a person's positive emotions, helping to reframe emotions, using empathic redirection when they're really stuck, and ruminating perhaps in some ways that they just can't get beyond everything that's happened to them related to this cancer diagnosis. So we help them to develop the strengths and the capability and the capacity, increasing their opportunity for understanding their emotions and their hope, and enabling well-being and flourishing. And what we want to do is change this narrative, that it becomes that, as Mukherjee says, what patients see through the glass is not a world outside cancer, but a world taken over by it, cancer reflected endlessly around them like a hall of mirrors. This so much reflects what I hear, of course, in what cancer patients experience and go through. And we're trying to shift that, working with them to reconstitute their identity, to find what is their new normal, although I say that new normal cautiously because that doesn't necessarily apply to everybody. And it so often that new normal is really just about, I want to get back to me and who I was before cancer. And what does that look like for me now? And what do I need to think about now? And how do I regain, my sense of personhood, my sense of identity, all of those things that become so important. That's the narrative that we're trying to change. So coaches certainly can create pathways to hope and thriving, as I said earlier. And here's a really good example and if you get a chance to listen to the Cancer Coach program that was in existence at the Ottawa Cancer Foundation, that cancer really does help patients to navigate the overwhelming diagnosis and to do all the things that I just spoke about as well. But here's a quote from one of the clients in this program: "I don't know where I'd be today without a cancer coach," says an Ottawa mother. So if you get a chance, you can go on and listen to the White Coat, Black Art, where the cancer coaches talk about their experience in the Ottawa Cancer Foundation coaching program, and what that was like, and what it was like for individuals with cancer to come in and receive coaching within that program. This is just a nice quote to kind of summarize that. "My health coach has given me a life jacket. My coach, like the life jacket, kept my head above the uncertainty and sometimes murky waters of cancer. Doctors work diligently and save our bodies. My health coach works diligently to save our lives. She is giving us the tools to not just live in cancer, but to thrive through cancer." That's a very nice sort of summarization of what I've spoken to on the previous slides. It also means that, as the whole sort of healthcare environment within which we find ourselves is starting to clearly shift, that we need to focus much more on wellness, less so on illness care delivery and much more on wellness care delivery. What's particularly salient for that, for me, from that thinking is, of course, for people with cancer, so much as I said earlier, that illness, of cancer is overwhelming. It's in the foreground. I focus on my illness. I'm sort of thinking about I'm a cancer patient now. They don't see beyond that sometimes. So illness is in the front ground, if you will. And what we try to do is move it so that it's there and they're handling it and they're learning the self-management skills to deal with the illness, but we're focusing on wellness. So often I hear with clients that come to me that they feel like they're walking two roads, especially I do a lot of coaching with people with chronic cancer and they know the cancer is going to come back. They have not the greatest prognosis. And so they're trying to figure out how do I, not spend every day focusing on all the tasks I need to do now that I've been impacted physically or functionally due to the cancer and the cancer treatment that I experienced. But they're on that road. There's a whole lot of fear in that road. They're fearful of even taking, a trip or a journey or enjoying something in their life because they're afraid cancer is going to come back. Should I join that group, that group, whatever it is that I want to join that's all about camping or, dragon boats, because maybe I'm going to get sick again and maybe then, I will disappoint them. I won't be able to help them. I won't be there to fulfill that promise that I made when I joined that group, as an example. So they kind of get on this road of fear becomes this huge barrier to them living this fulfilling life that still exists for them, or to regain that sense of wellness and purpose and meaning in their life, and all that entails from their perspective of their own values. And it means for us as coaches that we do then think about the second road, which is, they're walking those two roads. And what they're trying to do is to get to that second road where they're regaining and restoring their wellness, where they're living a life with purpose and meaning, and regaining all those areas of wellness and well-being, and who they are as an individual and a person before cancer became this overwhelming thing that became who they were. So we bring wellness to the front ground, if you will, and put illness a little bit in the background and help them to get through that overwhelming fear that can prevent them from moving forward. And of course, handle the issues of grief and loss that are part and parcel of that experience as well. So you might be asking yourself, so is there, I really would love to do this. I have the passion to do it. I want to make this difference in cancer coaching. I really want to take this on. But I'm really worried about is, I want to make a career out of it. So how can I do that? Is there going to be a career in health and wellness and cancer coaching for me? Again, as I said earlier, you're gaining those competencies so you could actually provide health and wellness coaching to a broader population than just cancer populations. But we're giving you that extra specialty of working with health and wellness coaching competencies to deliver that to people with cancer. But you can kind of see there's a huge growing demand for health and wellness coachings. And so we are on the tip, if you will, the tip. We just need a little bit more political will, but we're definitely on the tip. And certainly there's medical billing that is looming on the horizon in the US. And so, for instance, the Mayo Clinic, who already has lots of health and wellness coaches, and other health institutions recognize the deep need for coaching, but they're waiting for that opportunity to be able to bill. And I understand that that will be announced any day for health and wellness coach billable hours, that they can take health and wellness coaches on in their clinics, etc. And then, of course, if you look at this slide, you can see that the job outlook for health coaches is just growing exponentially. So in 2023 and then beyond, the outlook looks quite optimistic if you look at the growth on this particular chart. The expectation is that it will grow at a rate of 6.7% each year right up until 2030, with an expected worth of almost 20 billion by 2026, 23 billion by 2028, and 26 billion by 2030. So the health and wellness coaching and the economic aspect of that is just growing exponentially. And so much is shifting, as you know, since COVID and so the mental health issues that occurred as a result of that, and some of the challenges that we're seeing in terms of health and diversity in health and the underserved populations, and how challenged and how they had great difficulty getting through the experience of some of these pandemics that we've been through. So it's really a growing industry. And what's most exciting for all coaching practitioners is there's many paths to pursue, from self-employment to corporate fullness and hospital settings. We actually trained a person who's doing cancer coaching through the Melanoma Cancer Association in Canada. So she trained with us when we had this program that we had at York University, which is now our revitalized program that is now board accredited, as you know, if you've been on our website. But it also means that there is that opportunity within peer support agencies. And then, of course, there's a large virtual job market in the US. Just do a quick search on Indeed and others, and you'll see the number of coaching jobs that are now available. Many of them are virtual coaching jobs as well that become available. And when you think about that burgeoning growth in health and wellness coaching, and hopefully we're going to see that growth within cancer coaching, so that no one has to go through the experience of cancer alone, that they have an opportunity to have really excellent and exemplary supportive care. But that supportive care also includes access to a cancer coach. And so if you look at this most recently released landmark clinical trial, it showed that exercise, and these studies have been out there for a while, but this is the largest study, the most robust study that particularly focused on coaching, health and wellness coaching applied within the context of supervised exercise. And so what those results were pretty impressive, that there was significant reductions in disease recurrence and new primary cancers that were seen, and again, in a robust clinical trial. So after 5 years, the disease-free survival rate was 80% for those in the exercise program, again, compared to 74% for those who just received educational materials. And unfortunately, many of the people that we work with within cancer are often told, you just need to get more active. You just need to go walk some more, or they get multiple pamphlets to learn about exercise and the benefits of exercise. But what this study has again taught us, that it is that ability for someone to walk alongside with, provide goal setting, work on our goals, and as additionally to coach us through that experience of regaining strength during cancer and after cancer, to be able to adopt an exercise program and build on an exercise program and gain confidence and self-efficacy to get up to the kind of required amount of 150 minutes of exercise per week, as per the American Sports Medicine Group for cancer. And again, patients in the exercise group had a 28% lower risk of cancer return or new cancers developing. We know there's a significant impact of both exercise as well as healthy diet on both survival outcomes, mortality outcomes, but also in terms of cancer prevention, and for reducing risks. So again, the overall survival rate at 8 years were 90% for the exercise group. And for those who received educational support, it was just 83%. That's a 37% reduction in risk of death for the structured exercise group. And what that means around structured exercise is there's a coach, it's a specific dose that's provided, and that coach is really there helping that person to adopt a behavior, make those behavior change. They're counseled on the behavior change. And that's a huge risk reduction. So we think there's going to be, much more burgeoning demand for cancer-specific coaching, health and wellness coaching that's really applied to cancer population, because so much of what we do is focused on behavior change. I'm not suggesting that as a cancer coach, you're going to actually be prescribing exercise prescriptions, but definitely as part of goal setting and working with patients around their symptoms of fatigue, working around rebuilding their health, you're definitely going to be working and guiding them around goal setting related to physical activity and healthy nutrition, all of those kinds of things in a general way, but also with knowledge of what are the guidelines related to these areas and what are the benefits around that as well. And you'll be working with their stages of change, which is critical for them to actually be able to move from this stage of I'm kind of ready to take on physical activity to actually moving to, a program of physical activity that they're maintaining over months and years. So that's what we partly do as cancer coaches. What's particularly unique is the Healthville Advantage. So you know that we are, this course was a York University course. We are now offering the course, and it's a revitalized course from the York course. We've added a lot more positive psychology, a lot more understanding of stages of change and working with people around stages of change. Everything one would need if one wants to be able to write the exam and become a national board certified health and wellness coach. What's particularly unique about us is that you have the advantage of Healthville. And Healthville is really dedicated to the support aspect of a patient's cancer journey. And it's really focused on cancer care and supportive care and managed supportive care journey, so that it's not this, this crazy aspect that we see people with cancer go through of trying to find the support and turning here, turning there, turning to Google. With Healthville, we have that opportunity to create a seamless journey and one where they can get the support they need to meet their needs. So much of what we see in gaining resilience and thriving and flourishing in cancer has everything to do with the support that's available to them, the ability to help them navigate through that experience. And that's what Healthville is really all about. So our sort of three pillars, if you will, for Healthville is certainly the cancer coach. So the certified cancer coach, and hopefully that's you at one point in time. But it is that personalized human interaction that cancer coach is working alongside, providing the guidance, the practical advice, the personalized coaching with that aim of improving wellness, quality of life, well-being, and all the other things I've talked about already. And then a cancer concierge aspect where there is navigation, care guidance, and coordination, and that opportunity to interface with a global ecosystem of providers. So, so often with cancer coaching, we may find that the people we're working with really do need more psychotherapeutic approaches to their mental health. They sort of get stuck in coaching, and that would be an indication that they really need additional counseling. And so often they talk to me all the time about how challenging and difficult it is to find that, especially when they're no longer within the kind of acute cancer system, to find that within their local community. Certainly there are virtual programs, but we offer that access to a curated set of providers, so that ecosystem of providers that are curated. We know they're high quality. We're bringing them into and under our umbrella of the Healthville family as well. And then part of that curated global service provider ecosystem is also the transaction platform, where there's an opportunity to not only have that curated and managed list of service providers from all over the world, but it is accessible on a global scale. It's accessible and relevant for where that person lives in the context of their cancer care system and their life, wherever that is, if it's in India, wherever it might be. So we give them that context that is relevant to who they are as individuals. And what's really, really the Healthville advantage for you, should you decide to move in that direction, once you've become one of our certified cancer coaches and National Board Health and Wellness certified, of course, as well, is that you will have an opportunity to be within our curated group of cancer coaches and have access to the provider ecosystem, the platform and matching of clients to you. So when you're thinking about, going into this endeavor and thinking, oh, I need 50 hours in addition to this training to actually be able to write my National Board Health and Wellness Coaching Certification exam, you'll have an opportunity to gain those 50 hours required, you know, potentially under the Healthville family, of course, as another opportunity for you if you meet our interview criteria and credentials that will bring coaches into this program as well. But it also means that we will potentially, if we bring you in, we'll have that opportunity to allow you to use the platform, and also be able to match you with cancer clients. So the question I get asked all the time related to this is, of course, who pays for the program? Who pays for the service? Who's going to pay for cancer coaching? So I've already told you about, if you are going out as a cancer coach within any of those sort of umbrella areas that I talked about within a corporation, etc., or if you're going independently, you could be charging for health and wellness coaching if they have private insurance or third-party payers who can pay for that. So we think about that in terms of who will pay, and one of the things about the Healthville endeavor is that we are looking for all opportunities to deliver cancer coaching on that wider scale that I talked about earlier. So the other thing is that, contrary to popular notion, people with cancer and caregivers in many high-income countries like Canada spend 16% of their annual income on out-of-pocket expenses. And I suspect it's much higher than that in terms of their opportunity cost, of the cost of their time trying to find the resources they need, trying to navigate multiple siloed healthcare systems, and try to traverse that and not being able to access the care. That's hugely expensive to people and hugely burdensome for them as well, but also very expensive. We just don't often think about those other out-of-pocket costs related to, even return to work, but also for instance, they're paying for all kinds of other services to try and figure out, how can I get my wellness back? How can I restore my health? What's the beauty of this program? Of course, we're providing the cancer coaches to help them with that, but also to navigate through these complex siloed systems of care that are in existence throughout the world. We think about, of course, employee assistance programs, federal departments and agencies and employers willing to support their cancer patients bring on a program, and we'll be meeting with all kinds of these, corporate wellness around cancer populations within corporate entities, etc., and hopefully bringing them this program to be able to help their cancer populations both to return to work, but also to actually thrive and regain and restore their wellness and health. Health insurance benefit provider companies, again, many group benefit packages do have extended healthcare benefits that are just this sort of openness around, a $500 per year or whatever it might look like, that there is extended healthcare benefits they can use for. So they're already using them for things like massage, potentially registered massage therapists. They can use those potentially for health coaching and for coming on to the Healthville supportive care, managed supportive care program. And many of these are, of course, available in the US, UK, Australia. And then what's particularly unique about Healthville is this creativity around the service bucks. So often we hear from patients' families or their extended friends network, what can I do? They feel so helpless and they're trying to say, how can I actually help this person? And sometimes that means they show up with groceries and drop them on the front desk. But just think about this for a moment. If they could actually provide service bucks to this person to be able to, so in a sense, it's kind of like personal crowdfunding, that they could actually gain benefits for accessing all of the ecosystem, being able to put into their wallet, the Apple Pay wallet kind of approach, buy the service bucks. And it may mean that cancer charities and similar groups and organizations could also buy service bucks for their members, to actually have the benefit of the cancer concierge and the cancer coaching, and the ecosystem within the Healthville family. So just in closing and to wrap up and to summarize then, so, cancer coaches are really powerful in being able to change the narrative of cancer, to really help people to restore, and optimize their health, both through the counseling and the coaching around the emotional aspect, but all that whole person aspect of living with cancer and what that's like for a person, and hopefully to optimize their health, their wellness, their chance to thrive and flourish through cancer and after cancer, so they truly are living their best life. So that's what cancer coaches do, but they also do it with a very specific set of skills and techniques that we'll be teaching you in this course. So yes, anybody can hang up their shingle, but they often do not have the kind of skills, techniques, and training and competency requirements that we are focusing on this cancer coaching course and the National Board for Health and Wellness Coaching, which is critical for being able to bill for cancer coaching services. So we know this can make a huge difference to the lives of people with cancer. And I know your passion for even thinking about coming into this program is probably what's fueling you to think about, yes, I want to bring health coaching, cancer coaching to people that I know that have personally experienced cancer, and to those who I've actually worked alongside in my healthcare professional role, whatever that might be, to bring cancer coaching on a wider scale, that no one should go without having access to a cancer coach. So we ended there with some discussion and questions, and I encourage you, if you have any questions or comments, to please email myself or Marianne or any of the members of Healthville about the course, and certainly we're happy to help you with any of those questions or concerns that you might have. Thank you so much. And just to remind you, nice to see you all. And I am Doris Howell, the program director for the course, as well as the lead cancer coach for Healthville. So thank you, and I look forward to meeting you all should you choose to join our course. And hopefully you want to make that difference for people with cancer, and that you will join our course. Thank you so much.